they're seeing their premiums sometimes doubled or tripled, where it's crushing them. That's not fair.
A Texas senator pushes his vision to change health care coverage, but his plan has some Texans rising up to protest. Good morning and thank you for joining us for State of Texas. I'm Josh Hinkle. Texas Senator Ted Cruz is playing a key role in the health care debate in Washington. His opposition to the current Republican plan has helped lead to a flurry of negotiations. This week, the senator traveled across Texas to talk about his proposals. He says he's against the current Senate plan because it does not do enough to cut costs. His plan would require each insurance company to offer at least one plan that meets current Obamacare requirements, but allows companies to offer other low-cost plans that don't cover everything. We reached out to the Center for Public Policy Priorities. They're worried that lower-cost plans could leave people in need without essential health insurance coverage.
The idea that Congress, or specifically the Senate, is looking at is whether you should have two parallel markets. One with consumer protections. You can't charge people more if they're sick. You can't deny people if they're sick or have pre-existing conditions. And another one that's unregulated. Insurance companies can deny people if they've got pre-existing conditions and can have really skimpy coverage. What that does is create a de facto high-risk pool in the coverage that has to have benefits and can't deny people if they're sick. And we know a lot about high-risk pools. We know that premiums skyrocket when the only people who buy a certain kind of insurance are really sick. And the problem with doing that in this bill is if you're low enough income and you get a subsidy, you get some protection. But if you don't, if you're an individual who earns more than $42,000 a year, there's no help in the Senate bill for you. And if you needed comprehensive coverage, if you're a cancer survivor, if you know you want to get pregnant in the next year, if you've got arthritis, if you've got asthma, and you're going to get turned down in the unregulated market, you have to buy full cost coverage with premiums that have gone through the roof. We're going to see a lot of middle income people with healthcare needs who have to go uninsured.
Protesters met Senator Cruz at every stop on his tour. They're worried about potential cuts under the Republican plan. The Congressional Budget Office projected that millions of Americans would lose health insurance if the plan passes. Senator Cruz has a different perspective on the debate. He sat down for a one-on-one with KXAN political reporter Phil Prazen to talk about his plan.
Thanks so much for joining us.
Good to be with you.
So, Senator, let's just start off, I guess, with the baseline. We've been hearing for 8 years now that, I mean, people did say day one, once Republicans get control of the power in Washington, we're going to get rid of Obamacare. And 6 months, it's still here. What's the holdup?
Well, we need to come together and get it done. In the Senate, the challenge is that Republicans have a very narrow majority. We have just 52 Republicans. Sadly, the Democrats have made clear that they have no interest in working with us on substantive steps here, and so we start out with 48 hard no's. That means that we've got to bring together at least 50 out of 52 Republicans, and that's challenging. There's a wide ideological diversity.
The delay in the vote has come from two fronts. Moderate senators from states that expanded Medicaid don't want to cut the program that helps cover moderate to low-income people in their states. And on the other side, a group of conservatives don't believe the bill repeals enough of the Affordable Care Act.
We don't yet have full agreement, but what I have been pressing as a way to bring together and unify the conference is let's focus on two things. Number one, that we honor a promise to finally repeal Obamacare, as we've been telling the American people for 7 years. It's the biggest job killer in this country. Millions of Americans are hurting under Obamacare. And number two, I believe our central focus should be lowering health insurance premiums.
When it comes to the process of how this moved forward, I remember the criticism of Obamacare was made in the back room and said, here's America, here's your bill. There's been the criticism that the exact same thing has happened in reverse. Can you give me a little idea of who you've been talking to that aren't lawmakers, that are healthcare professionals?
Well, look, I think it is a very, very different circumstance. Number one, there has been no political issue debated more in the last 7 years than Obamacare. It has been front and center. We've had 3 national elections where Obamacare was central. Throughout this, a number of us, including the working group, including myself, have met with healthcare experts at think tanks, have met with leaders in the insurance industry, have met with healthcare professionals, have met with the heads of hospitals, have met with doctors. I mean, I can tell you just on my own, I mean, I've had probably hundreds of meetings with experts across the board on how to address this problem. The question I ask more than anything else when meeting with experts, how do we lower premiums? If we lower premiums, that's a victory. If premiums keep skyrocketing, that would be failure.
The CBO score that we just saw from, not your amendment, but the Senate's plan, it did have premiums going up before they went down.
Right.
Are you worried about people won't notice a change fast enough and say, you actually made the problem worse?
Right. Now, look, that's absolutely right. What CBO projected is that in the first year, premiums would go up 20%. The next year, they'd go up 10%. I think that's completely unacceptable. And it's the reason why the first version of the Senate draft, I, along with 3 other senators, said, listen, we can't support this bill. We want to get to yes. We want to keep working on it, but we've got to lower premiums more. And so I have been pushing common sense reforms, and 2 in particular. One that is reflected in the bill already, which is allowing people to use health savings accounts to pay health insurance premiums. That's illegal right now. Now, what that does is that lets you pay your premiums with pre-tax dollars. For many people, that is an immediate reduction in premiums of 20 to 30%. That's a big deal. The second major reform that we're still debating, it hasn't been agreed upon yet, is the Consumer Freedom Amendment that says you, the consumer, ought to be able to choose what health care you want to buy, that it shouldn't be the federal government mandating what every policy has to include, but you should have the right to choose. So if an insurance company sells at least one policy in a state that meets all of the Title I mandates, it can also sell any other policy that consumers desire. What that does, it doesn't take away any choices. The existing choices remain there, but it adds additional new choices, low-cost, affordable plans.
I just talked to the CPPP, a liberal think tank here in Austin. They said that...
let me guess, that they're not fans.
You know, they actually say that, your plan would create a high-risk pool that would create lower premiums or lower cost, affordable health care for people under $42,000. They have a problem with after $42,000, and if you're sick, if you're not healthy, then you get hit with the premiums that have to cover the people in the high-risk pool. Do you worry about that?
There is significant agreement in Congress that the federal government is going to provide meaningful support for people with serious medical conditions. In my view, we should do it honestly and directly. Don't jack up the premiums to a bunch of people who are struggling and force them to pay for it. Do it directly through tax revenues. And so what the Senate bill does, it does it through 2 ways. Number one, there's a tax credit that is keyed to the premium that remains in it. And so, as you noted, people below the thresholds would receive substantial direct tax revenues. But number two, there is also what's called a stabilization fund, and that is tens of billions of dollars that go to the states for the express purpose of stabilizing premiums on the exchanges. And those funds are designed to be used for the people you're talking about, for people above the income threshold who otherwise might see higher premiums. And I think it's much more fair if we're going to provide assistance to people in that circumstance, do it from Warren Buffett's taxes and not from a 28-year-old struggling to make ends meet.
How big is the stabilization fund, do you know?
It is very substantial. It's still being debated, but it is in the tens, if not north of $100 billion. The number is being actively debated, but it is a very substantial investment in the stabilization fund.
When it comes to the essential benefits, right, these are the mandated coverage thing that under the Affordable Care Act you have to cover. Can you convince the people that are worried about this that even if it's not covered, it will still, if it's not mandated, it will still be covered by an insurance provider out there?
Well, the Consumer Freedom Act does is it keeps the mandates. It says that in any given state there will be policies that meet all the mandates, that have all the bells and whistles, that have the full Cadillac plan. Those will still be provided. But in addition, insurers will also be able to sell other plans, skinnier plans. They may not have the full coverage, all the Cadillac, all the bells and whistles. But let's say you're a young person, you're starting out your career. You may not be able to afford the full Cadillac plan. The premiums right now may be so high, you say, look, I can't afford this at all, so you got nothing. You have no insurance. But you might be very interested in buying, say, catastrophic coverage. Right now, those policies are largely illegal. You don't have the option of purchasing a less expensive plan. And so what it means for many families that are struggling is they have no insurance at all because Obamacare, the average family's premiums under Obamacare have risen over $5,000 a year. That is the biggest problem with Obamacare. That's what we got to fix.
And it's up to me to know what is provided.
I think at the end of the day, you know more about your health care needs. I trust you to choose. I trust you to have, with freedom, I trust you to care about your family's needs more than anybody in Washington, and to make rational choices about what insurance do you need and what do you want to insure against.
Senator, thanks for your time.
Thanks a lot, Phil.
Work on the health care bill will resume next week when congressmen and women and senators return to Washington. Senator Cruz will be up for re-election next year, but early polls show he has some work to win voters over. Last month, the University of Texas and the Texas Tribune polled registered voters to see what they thought of Cruz. 44% of them said they don't like the job he's doing in the Senate. 38% support him. The rest were either neutral or didn't know enough about Cruz to answer. Democrat Beto O'Rourke plans to challenge Senator Cruz in the 2018 election. The congressman from El Paso has been campaigning around the state since April. He's reaching out to places where Democrats don't usually do well. For example, he held a 4th of July rally in Lubbock. His message taps into discontent with Cruz, but also President Trump.
There has never been more on the line for this country. We've never been as tested as we are right now, at least in the 44 years of my life. And the institution, whether it's the courts that are having to deal with the travel ban, whether it's the press and the media, which have been called the enemy of the people by our president, or whether it's our democracy, which will decide in 2018 what the United States Congress, the United States Senate will look like. It is all on us. So if you don't like the Muslim ban, if you don't want a 2,000-mile wall at a time of record low immigration and issues with Mexico, if you want something better for your community, if you want to focus on jobs, the economy, and making sure everyone has access to health care, then you got to work for it. You got to organize, and you ultimately got to vote.
O'Rourke is the underdog against Cruz, but an early poll shows it could be a close race. Back in April, Texas Lyceum asked voters who they would support in a Cruz versus O'Rourke election. The poll showed them tied at 30%, but 37% of the people polled said they had not even thought about the race. It's a legal battle that could change who you see on the ballot in the next election. We'll look closer at the case that could redraw voting lines right here in Central Texas. Starting Monday, a federal judge in San Antonio will hear arguments in a case that could change who represents you in Congress. It's a lawsuit that claims Texas maps for congressional voting districts intentionally discriminate against African Americans, Hispanic, and Latino voters. If the state loses the case, the judge could order new maps to be redrawn. That would change who's on the ballot when you vote next year. This map online shows the boundaries of all of the congressional districts in Texas. The court case calls out 3 of them as being possibly illegal. We'll zoom in and show you the District 23 here. It's all shaded here in green. It stretches from San Antonio all the way west to El Paso County. Congressman Will Hurd represents District 23 in Washington, and it's one of the few districts in Texas that's seen close elections in recent years. The court case also affects District 27. It's shaded here in yellow, you see, all the way down to the coast from Bastrop and Caldwell counties, including Corpus Christi. That's the hometown of the congressman who represents the district, Republican Blake Farenthold. An oddly shaped district that covers part of Austin is also part of the court case. Take a look. District 35 here is in orange. It goes from parts of Austin down through Hayes and Caldwell County and ends up down here in Comal County and parts of San Antonio. The district is home to Lloyd Doggett. He's the only Democrat among the 6 congressmen who represent Austin. To be clear, it's not against the law to have districts with unusual boundaries, but it is illegal to create districts that intentionally lower the influence of minority voters. Lower courts have said state lawmakers knowingly discriminated when they created the Texas maps, but if the court in next week's case plans to change those maps, they have to act quickly. The next major election is less than 9 months away. The party primaries in March of 2018, but new districts would have to be drawn several months before then. For example, candidates in the March primary start filing to run in November, and the final deadline is December 11th. And the local elections administrators also need time to get ready. They've told the court they'd need new maps in place by October to give them time to send out voter registration cards. Senator Cruz could hold the key to a deal on health care. He's proposing an amendment that some believe could break the deadlock in D.C. We'll take a closer look with our roundtable next. And later, a call for change in a district held by one woman for more than 20 years. Why some Austin voters say it's time for her to leave. The fight over the future of health care is being fought in Washington, but it will have far-reaching impacts here in Texas. And fittingly, a Texas senator could hold the key to a deal. Joining us for perspective on the week ahead, Patrick Svitek from the Texas Tribune and our own Phil Prazen. Welcome to both of you.
Thanks.
Thanks for having us.
You've been covering that this week. How has he been received so far?
So he's on a tour of these town halls right now, and they're relatively controlled. You have to register ahead of time, but even in that context, he's gotten a little bit of pushback from some of the audience members. He's gotten into a number of spirited, I would say sometimes testy exchanges with audience members who clearly disagree with the overall plan to repeal and replace Obamacare.
And it's not just Democrats. He's getting some opposition from his own party.
Oh, yeah. I mean, especially when it comes to Medicaid, and there was a couple specific questions on how the Medicaid cuts on future growth would impact veterans, and that was exactly important to this town hall that these town halls he's been doing. They're hosted by Concerned Veterans for America. But, you know, he is the only Texas Republican leader in Washington that's actually facing a crowd and answering questions. I mean, John Cornyn's not having town halls. None of our congressional leaders are having town halls. And I took away from some of these events that he actually wants to have this debate at least.
And he's sitting down and talking to the press.
Yeah, and the only one doing that on this recess.
Yeah, you could see Phil's interview on KXAN.com, right?
Yeah.
Little plug for you.
Yeah.
No, so, you know, is there a compromise inside anything
Well, I think the
bipartisan?
reason he's doing this and being so public and out there this week is because he does have this amendment that he's promoting, and he really wants to get the Senate Republican Conference on board with it. He's presenting this amendment as a compromise solution, and he's saying that it could also, or suggesting at least it could also move the bill in a more conservative direction. And so he's been promoting this amendment, what he calls the Consumer Freedom Amendment, at basically every stop and in every interview he's been doing across Texas this week. And so I think the reason you're seeing so much of him is because he really wants to, you know, make sure that the message is getting out there that this is the way to do it. And as you pointed out earlier, there are some members of his party who, especially more moderate members, who do not seem to be big fans of this amendment.
And I doubt that he's not thinking about 2018 and the election. I mean, how's, you know, we've talked about health care, but is anything else going to be popping up for Ted Cruz that he might have some trouble with?
I mean, I do think that the defining issue of this next 2018 cycle is going to be this health care issue, because some of the reforms that they want to do take effect next year and will impact people in an election year. And so they're either going to love them or hate them.
What do you think?
Yeah, I mean, the political stakes for him are definitely high. I mean, number one, he came into office in 2012 telling voters in Texas he would basically, you know, obliterate Obamacare. I mean, he said repeal every word of it. And so he's trying to make good on that promise from years ago. At the same time, he's trying to do so in a way that is consistent with the kind of conservative promises he's made. And, you know, I think it could be problematic for him if he is a no vote on an you know, if this gets to a vote in the Senate and he ultimately is a no vote, I think, and especially if he is opposite the president on a health care plan and votes against a plan that the president wants people to vote yes on, I think there could be, you know, consequences in Texas politics for that.
And his only opponent so far, Congressman Beto O'Rourke, is pretty open and out there for a single-payer system, right? So there's going to be that public dialogue about what kind of health care this country needs.
Yeah, it's a very clear contrast in that race.
Well, looking ahead to the week that's to come, you know, we have been talking about the court case dealing with voting. You know, is this going to have any impact on maps that you can see?
Absolutely. I mean, the case in San Antonio could drastically shape the future of Texas politics. It depends if it gets kicked out to the legislature to draw the maps, but, you know, some people are telling me that the 3-judge panel could actually redraw the maps. And we, you know, in our area, there's Lloyd Doggett's district, which impacts 5, 6, 7 different congressional races, and so that's all going to be up in the air. And I believe the judges say that they want to have new maps by 2018.
right?
Right. I mean, there's a lot of uncertainty right now. You know, one thing that's for sure is that the clock is ticking. I mean, candidate filing opens in November. I think the deadline for 2018 elections, at least state elections, is in December. And so this, you know, I think if you're a candidate looking at running in one of these congressional districts, the time frame is pretty short right now, and there's still a lot of uncertainty.
These maps keep drawing out, and it's going to be the next decade, and we're going to have to redraw maps anyway.
Well, yeah. And that's just politics 101, right? You know, it's a question that we have to deal with every 10 years, and then, you know, if it goes into a court battle, you have to deal with every 2-3 years, sometimes every other year here in Texas.
Yep. And speaking of the future of Texas politics, we've got a special session right around the corner, so I'm sure you guys are both going to be covering that, so we'll have to have you back on.
Absolutely.
All right.
Anytime.
I appreciate it. Thanks, guys.
Thanks.
There's a push for new leadership in a local district held by one woman for more than 2 decades. How some groups are kicking off an effort today to get voters involved. Texas lawmakers are gearing up for the start of a special session just over a week away, but some local voters are already looking ahead to next March when they'll choose candidates for the next legislative election. Later today, voters in Austin District 46 can meet some of the candidates. 5 Democratic candidates have announced their intentions to run for the seat. They'll all be at today's candidate forum. They're vying to replace State Representative Donna Dukes. She's been largely absent from the legislature during the past 2 sessions. Democratic leaders in House District 46 hope this forum will get the community involved and result in better leadership.
We felt it was important to have this forum before the special session so that we can begin a conversation, begin talking about the real needs and concerns and challenges that are being faced in our district, Texas 46, so that going into the session, our hope is, as Dukes is listening, if she's listening, watching what's going on in the district, that this may be something that might motivate her to be more proactive in the special session.
Today's forum is open to the public. It's happening from 2 to 5 this afternoon at the Austin Community College Eastview campus. Thank you again for joining us for State of Texas. Stay tuned for Meet the Press coming up at 9. I'm Josh Hinkle. Have a great day.